simple terms, LOINC stands for Logical Observation Identifiers, Names, and Codes. More simple terms, it's basically just the standard language we use to identify lab tests and their clinical observations. So anytime you have a lab test that's ordered or resulted, that's always reported out in LOINC as the consistent code system that's defining exactly what was measured, how it was measured, and under what conditions. It's really the foundation that allows lab and procedure data to be understood consistently across systems, organizations, and care settings. One of the biggest challenges with LOINC is that it's just constantly evolving. So they've got new tests that are being introduced consistently. You've got existing codes that are updated. The standard itself within LOINC and kind of how they're releasing, it's expanding. So these updates happen regularly too, which means an organization has to continuously maintain and realign their mappings right alongside of LOINC's releases. So the challenge to me is that because many health systems are doing this manually, it creates additional work. It introduces the potential for inconsistencies in the data. It's definitely going to disrupt your clinical workflows, and it can also impact reporting and interoperability if it's not handled correctly. LOINC mapping is complex because it's not just a simple one-to-one code match. So each LOINC code is built across 6 different dimensions, like the component being measured, the specimen type, timing, the method. And that level of specificity is what makes it powerful, but also incredibly difficult to map. On top of that, organizations are often managing tens of thousands of mappings. Many of those mappings require manual research and validation for people who have very specific knowledge of LOINC. And again, it's typically done by your highly skilled staff who have limited time, and it's just not a great use of their time. So it becomes both like a technical challenge and a resource challenge, especially at scale. When LOINC mapping isn't accurate or maintained, it can create like a cascade of issues across the organization. And I wouldn't say that this is just for LOINC codes, but for procedure data in general, I just think it can be more difficult when we're talking about LOINC codes. You might see downstream LIS or lab information system workflows that can't operate effectively without your LOINC coding being up to date. Again, you might see some gaps in interoperability, incomplete or inaccurate reporting, thinking about those things like your CMS reporting programs. And you're also going to see an increased operational burden because teams might have to manually fix, reconcile, or just keeping it up to date is complex. In some cases, those missing or incorrect LOINC codes can even impact patient care because the data needed for decision-making or reported isn't complete or trustworthy. So maintaining LOINC isn't just data exercise. It's critical to ensuring the entire system really functions properly.